The title of this work is Clinical Application of Virtual Mechanical Testing Measures Slow Fracture Healing in Patients with Comorbidities. We are interested in structural bone formation during secondary fracture healing. This takes place on a continuum including fast and slow healers. A few common examples of risk factors for compromised bone healing include cigarette smoking, alcohol, and diabetes. This study focuses on tibial fractures treated by reamed IM nailing. We have studied both open and closed fractures, but today we are looking at a subset of 27 closed injuries. Of these, 20 patients had no known comorbidities, and 7 had at least one comorbidity known to increase the risk of non-union or delayed healing. The hypothesis is that patients with comorbidities have a longer time to union and lower early mechanical integrity. For each patient, we followed our published protocol to build a structural finite element model of their fracture. Briefly, the scans were segmented by applying density threshold and cleanup operations to create 3D surfaces. These volumes were then meshed and we applied element-wise material properties as shown in the section view image on the right. Once the finite element models were created, virtual torsion tests were performed in ANSYS Mechanical. The result of each test is a parameter called virtual torsional rigidity, or VTR, which is the moment reaction times the working length of the model divided by the angle of twist. VTR of the fractured limbs was normalized to the intact limb for each patient. The resulting percentage score for normalized VTR tells us how advanced the structural healing is in the injured tibia relative to the intact bone. Here we see the resulting structural models for all 27 closed tibial fractures, 20 who had no comorbidities and 7 who had at least one risk factor. Qualitative comparison between these groups show that in all cases, some callus has formed, but in the patients with comorbidities, there seems to be poorer bridging and noticeable gaps remaining at the fracture line. To see if there was a difference between the two groups in terms of the amount of callus formed or the density of the new tissue, we used the segmented masks to carry out morphometric assessments. Comparing the normal and comorbidity groups, we found no differences in callus density or volume, largely due to the wide variety of fracture patterns represented in both groups and seen in just 3 of the example models of comorbidity patients. In contrast, we saw a dramatic difference in the virtual mechanical testing results between these groups. Patients with comorbidities had 23% lower VTR than the normal group, a difference that was statistically significant. We compared this finding to the clinical union assessment performed by the surgeon and saw a slight tendency towards longer healing times in the comorbidity groups, which was not significant. This technique was able to detect differences in healing with patients that had a comorbidity. This could allow for smaller sample sizes in clinical studies to investigate the effects of interventions and risk factors. Thank you for listening, and check out our methods paper for more information on this technique.